On this episode,
I'm not sure he's not actually lacerated the jugular.
Alex desperately tries to save Roxy after the little dog was crushed by a giant python.
My concern with this patient is her external wounds are obvious, but there could be a lot worse going on the inside.
Hello, buddy.
An unusual visitor presents a big challenge for Kate at her Bondi hospital.
Sheep are the trickiest of animals to put under a general anaesthetic.
Oh, wow. Look at your eyes, buddy.
And the touching story of little rescue cat Rupert.
He's bumping into things. He's really relying on his other senses, like feel and touch and hearing, to negotiate the objects in the room. He might actually be completely blind.
You make my world a better place.
Come on, there's your girl.
I can't depend on you.
On the Gold Coast, Alex's shift has started with a dramatic emergency call from a terrified dog owner.
So we've had a call to say there's a dog coming down, has been found strangled by a python. We don't know what kind of state it's in, so we just got to set up and prepare for the worst. So the normal injuries are rib fractures, compressed chest, so often the patients need oxygen. And sometimes we even need to intubate them if they can't breathe properly, because obviously with the strangulation they compress the chest. It can be really nasty, and obviously pain relief. We don't know exactly how big the dog is, but we know it's a small dog, so get some tubes ready and just be ready to intubate if we need to.
With the team now ready and on high alert, traumatised owner Jenny is rushing in with her badly injured 10-year-old Maltese, Roxy.
Okay, tell me a little bit about what happened.
And because she can't run away because of her back legs.
Yeah.
Jenny is still in shock after rescuing her beloved little dog, but she's still able to explain that Roxy has very limited mobility in her hind legs due to a previous spinal condition.
Hey, sweetie.
And had no way to escape from the dangerous snake.
We're going to take good care of her, okay? Yeah, okay, you pop out the front. I'm going to come and update you shortly, okay? Okay. My concern with this patient is her external wounds are obvious, but there could be a lot worse going on the inside. So I'm surprised she's breathing as well as she is. She only looks like she's about 3 kilos, do you reckon?
I'm just going to give her half of it.
Yeah, cool, good idea. I've got a nice vein on this one. Okay, let's go. Good girl. Okay, sweetheart, let's try again. Got tape there, handy somewhere?
Yep, I'll take it.
All right, let's see if we can get this in.
Alex is giving the terrified little dog some much-needed pain relief as quickly as possible. When the painkillers start to take effect, Roxy is finally starting to be less agitated.
Oh, sweetheart. I do want to get an idea of how bad these wounds are.
Before Alex can start investigating any possible internal injuries, she needs to treat the nasty bite wounds where the snake latched on to Roxy's neck.
Just want to see how bad these bite wounds are. I cannot imagine how terrified she must have been. And she can't get away because she can't walk properly on her back legs. Roxy's a tiny dog, and a python's bite can be so powerful. I just want to see, there's a lot of blood coming from here, and
As Alex investigates the severe bite on Roxy's neck, she's suddenly alarmed that the snake may have inflicted a fatal wound on its helpless little victim.
I'm not sure he's not actually lacerated the jugular.
Let's get you into the van and get you all checked out, buddy.
Mobile vet Alison and nurse Amber have just picked up a stray kitten that was found wandering the streets of Brisbane. They're now off to do some tests after noticing something seriously wrong with the young cat's eyes.
Oh, wow. Look at your eyes, buddy. Hey, what happened to you, little guy? I wonder if you can see it all. Hello. So the first thing I thought of when I saw this cat is that it just does not look normal. You can see in its face, its eyelids look abnormal. The eyes are very, very small. He might actually be completely blind. Oh, this eye is so recessed in. So you can see that the eyelid is actually turned in. So he's got what we call an entropion.
It's all right, Papa.
So the eyelashes are actually poking into the eye, which is quite uncomfortable. And that would be happening because we don't have the pressure of a normal size eyeball flicking those eyelids out.
Alison suspects the stray's abnormally small eyes may be a condition called microphthalmia.
He may have been born with this condition. We don't know anything about his background. Or, you know, he may have been exposed to some toxin or virus, or even his mother might have been exposed to that while he was in the uterus. So we're going to do a quick vision test, which is basically an obstacle course. Pop him on the floor and see how he negotiates objects. Have a bit of a wonder? He's definitely using his ears and his whiskers. Very unsure. Looking at him, it's quite obvious that he can't really see. He's bumping into things. He's really relying on his other senses, like feel and touch and hearing, to negotiate the objects in the room. He's going towards the sound of people's voice. So I'd say he has very, very little to no vision at all.
Hey Gerardo, we've got Boris here.
Hey, Boris.
He's got a bit of a painful problem down below.
Oh, whoa,
Can see.
whoa.
At the emergency hospital, French bulldog Boris has a rather delicate problem.
The owners just noticed it sort of sticking out, so they're obviously really worried about what's going on and how we can try and fix him.
I'm worried for him.
I would be.
I feel for him.
It looks painful.
I'll take care of you, mate. I'll take care of you. Oh, that's got to be sore.
Ouch.
So what happened with Boris is that he got excited and his penis came out, but then it couldn't go back in because the skin rolled inwards. And now it's super swollen because it's been hanging out for so long. I'm going to give him some pain relief because that's definitely what he needs. Good boy. Hey, good boy, mate. Good boy.
Owner Merrin is understandably worried about his little mate.
I came in today with Boris, who has some issues. Started this morning, took him outside and saw the problem that he has. So we just went straight to the vet. Boris is about 8 months old. He's a fun little pup. Always gets into trouble, bit of a character, so hopefully he's not too much trouble after this.
Well, we got to put that back where it belongs. Hey, Boris.
Oh, he's got a deciduous canine, so he's definitely about 5.5 months. 6 months at most. Oh, we're purring.
In Brisbane, Alison is doing a full health check on a little stray.
You mustn't have got a lot of attention on the streets.
She's already discovered the shy cat is blind, possibly from birth.
We're going to have to give this guy a name.
He's pretty cute.
He's so cute.
What about, I was thinking, like, Rupert. I think
Rupert, that suits you.
I think it
Rupert,
does.
do you like your name? All right, let's have a look and see if you are a boy. I was told you were a boy, but let's have a look.
Hello. It's a bit invasive down there, isn't that?
You actually don't have any testicles down yet. At 5.5 months, you would expect the testicles to have dropped, but they haven't. So we've got to find out, where are they, or do they even exist?
The missing testicles are another sign of a possible birth defect.
See if I can feel if those testicles are in there. The other thing that it could be, but more rarely, is that they're actually ovaries. So even though he looks like a male on the outside, he may actually have ovaries instead of testicles that are in the abdomen, which is why I can't feel anything on the outside. It is very unusual for a cat to be a hermaphrodite, but seeing that there's other defects and other problems, it's quite a high possibility. Let's go and see where these things are, mister. Ready? All right, Danielle, this is Rupert. We just want to do an abdominal ultrasound today to look at testicles. Sure. We've actually got nothing that's dropped down there. Good boy. It must be in there somewhere. Okay, let's see if we've got testicles down closer to the scrotum. See if they're hiding there. Oh yeah, what's that? Must be that.
Testicle. I think we might have found the testicle.
So the good news is that we found testicles. They're actually quite low down. They're on their way out, so that's very good news. So we're definitely a boy. Well, Mr. Rupert, it's been a big day for you today. Hey, you've had a lot of tests done. You've been such a star patient. Hey, you've got that beautiful face. Who wouldn't love that face? My hope for him is that he gets adopted. I mean, his temperament is absolutely gorgeous, and we know that cats with the right care and the right home, when they're blind, can still do really, really well. Come on, let's get you something to eat. Off we go.
How's it going, Trace?
Oh, he's doing really good. He's settled down nicely now.
At the emergency hospital, Boris is in extreme pain due to an unusual problem.
The plan is we're going to do an anaesthetic and reduce the swelling and put the penis back to where it should be. We're going to de-sex him as well, so...
Sounds like a great plan. Hey, Boris. He may not be keen on it, but I think we'll fix
We
this
won't tell him
problem.
that. So Boris coming through. Anaesthesias in any dogs which has a flattened face have a higher risk of complications because their airways are smaller and compromised, and it makes it harder for us to intubate them. Okay, Boris, off to sleep, mate. We'll fix you up. You'll feel better when you wake up, mate. Let's go. Okay, tube in. Good. Check that. It's very delicate structure. Careful with these clippers. We may be able to just lift it through and pop it in. If we can do that, then once we do that... Oh. There's one thing we could try, and that is actually giving it a squeeze. It seems a little bit brutal, but there is an accumulation of blood in the tip of the penis, and if you squeeze it, what happens is the blood then goes away. So you can't do this when they're awake. And it's about 50% smaller. Okay, so I'm gonna pull up, okay, and if you could push it in, if we can. Go. Success. Look at that, we got it in. We have success. So next is castration time. Great. The hope is that that will reduce the amount of testosterone and hormones floating around and reduce the risk of that popping out again. Okay, making a cut. We've exteriorized one of the testicles. Now we're going to clamp through the vascular structures, and then we'll chop that one off. Okay, Tracy, that's one down.
Excellent. Nearly there.
Nearly there.
Nearly there, Boris.
Okay, that's 2 testicles out. Perfect. Okay. Let's have a look. So both of his testicles are out now, which hopefully reduces his male urges and reduces the risk of his penis getting stuck out.
2 hours later, Boris is fully awake, and it's time for Gerardo to check his handiwork.
You awake, mate? Oh, yes, you are. Wow, you want to go. You can't jump out. You can't jump out, mate. Boris has recovered from his anesthesia without any complications, and he's even trying to get up and walk out the door. Look at that. It's still in there. Good job. He's going to stay the night here because we want to make sure that he is 100% awake and alert and eating and drinking before he goes home. Have some rest. You go home tomorrow, okay? Okay.
In another part of the emergency hospital, Alex is desperately trying to save little Roxy after her horrified owner Jenny found her being strangled by a python.
It was horrible, you know. It was sort of like, oh my God, what am I going to do? You know, what's happening?
Amazingly, her breathing is actually pretty good. So she mustn't have got wrapped around her chest, but obviously bitten her around her neck.
Although Roxy was badly bitten by the snake during the attack, her jugular wasn't lacerated as Alex first feared.
She doesn't walk anyway on her back legs, so she must be permanently paralysed. And obviously they only carries her around, so...
X-rays will show if any of Roxy's internal organs have been crushed by the powerful snake.
From here, Roxy's going to be transferred into intensive care, and the overnight team will take some X-rays to make sure there's no other injuries like rib fractures.
For now, the little dog will be closely monitored for any changes in her condition.
Oh, you're such a brave girl.
On an unusually wet day in Bondi,
Come on, gorgeous.
an even more unusual pet is arriving at Kate's veterinary hospital.
Hello, buddy.
Emma, son Wayne and granddaughter Maddie have brought in 9-month-old Callie for some rather delicate surgery.
It's a really interesting day in the vet clinic today. I've got a sheep and we're going to be removing his tail today. Oh, he's so friendly, you guys. So friendly.
Callie is our pet sheep. He is a beautiful boy. He's so friendly. He's like a dog. If you scratch his ears, his back leg comes up and he starts going like this. He is just beautiful, one in a million.
But Callie has had a tough start in life.
His mother died when he was born, and his twin brother, and they had to raise him on a bottle.
Okay.
When it came time for him to become a meat sheep, she couldn't do it.
Okay,
and her husband gave her a month to find a home.
Okay.
Which is when I came in.
Yeah.
So.
Kate's more used to cats and dogs, but she also knows a fair bit about pet sheep.
We need to remove Callie's tail today because this tail is a risk. It's a risk to Callie's health long term. We know that sheep with long tails can quite often get fly strike, particularly in the hot Australian summer. Fly strike is where flies start to lay eggs in the wool and around the bottom, and then essentially you get this really large mass of maggots around that back end. We try really hard to do these when they're little, because it's slightly less traumatic, but it is what it is. He's still a young sheep. He is going to be okay.
All right.
Maddie, are you going to stay?
Yeah.
Yeah. Normally, people don't really get a chance to see their own pets having surgery, but in this case, Maddie works here as a vet nurse, so of course she's going to stay today.
See you, darling. We're good.
I personally don't know too much about watching sheep surgery, but I've seen Kate do every other surgery and she does it beautifully, so I made sure that he was okay.
So you're going to induce and then pop him straight on the table?
Let's do that,
Let's do that.
That's as low as the table will go, and otherwise it'll be challenging.
Callie's going to go under a general anaesthetic, full pain relief, the whole works. I've asked my good friend Ash Allison down from SASH, and that is because he's a specialist in anaesthetics. Sheep have quite a few stomachs, and that means that the risk here is that Callie regurgitates when he's under anaesthetic.
1, 2, 3.
The chance of him sucking that fluid back into his lungs is very real. This is where the risk is.
So we've just got a call from an owner. She's worried about her dog Turbo's eyelids, so we'll go check it out.
In Sydney, Audrey is heading to meet Sammy, who's the proud mum of a boisterous 6-year-old Shar-Pei cross called Turbo.
Come on, big boy. Turbo's, we've had him since he was 8 weeks old and he's very much part of the family. Being a Shar-Pei crossbred, we knew that as a puppy he could have some issues with his eyes, and just monitoring it over the last few years, it just started to get a little bit worse and worse.
Hello, Turbo. Come on in.
Go.
Oh, my boy.
Come here.
How have you been? So Turbo is a mix of Shar-Pei and American Staffy. Shar-Peis have a lot of excess skin on their head and it rolls into the eyes. It's quite common to see entropium or eyelid problems in Shar-Peis. So you can see that eye is quite sore. It's watering quite a bit. Is it just a clear kind of discharge that's coming out? Yeah. How long's he been squinting it for?
Oh, probably 3 or 4 years it's been on and off.
Yeah.
But just obviously maintenance every day, but it's getting to a point where he's uncomfortable and we want to try and get it sorted for him.
You can see that it's really sore. There's a lot of watery discharge there. And you can see his bottom eyelid is actually rolling completely into his eye. It's actually rubbing on his cornea and it just looks really red and sore in there.
You come in the house and he'll rub his head up against your leg or the bed or whatever he can find, just to try and ease some of the pain, I think. It does upset you as an owner. You don't want to see your dog in any pain and it's just irritating him constantly. Like some days he has really good days, but then others you can tell that it irritates him so much that he just gets so upset. Good boy. You're all right.
All right, so his third eyelid's very red. There's a lot of inflammation there. I'm just looking at his cornea.
Good boy. You're all right.
Probably about 3 millimeters rolling in. Oh, I know, it's sore. Having an eyelid that rolls into your eye and all that spiky hair rubbing on the surface of your cornea is very uncomfortable. You can imagine when you have a hair in your eye how uncomfortable that is, so this is a lot worse than that. Sometimes they do grow out of it. The skin kind of stretches into the head, but unfortunately in Turbo's case it hasn't done that.
The bottom looks a bit swollen.
Yeah.
Audrey's worried Turbo's eye could be badly ulcerated or scarred, which could lead to blindness.
So the plan is today I'm going to take him to surgery. We'll give him a general anaesthetic and what I'll do is I'll roll those eyelids away from his eyeball. So we'll just take a small slither of skin, push that back. He'll feel a lot better with that off.
Brilliant.
Get your eye sorted. Give you an eye tuck.
A little bit concerned. Obviously the poor thing's never been under anaesthetic before, so hopefully he comes out well from that. But I think he's in safe hands with Audrey. See you soon, mate.
We'll see you soon.
Bye-bye.
Bye, Mama.
Bye.
See you soon.
Bye. Bye.
At the emergency hospital ICU, it's been almost 24 hours since Roxy was attacked in her backyard by a python.
I'm surprised Roxy's coping as well as she is, but she is going to need pain relief and she's going to need antibiotics for some time.
Hey, you going to see your mum?
Roxy's traumatised owner Jenny is desperate to find out how her precious little dog is doing.
Good girl.
I'm really excited to reunite Roxy and Jenny. It's going to be such a special moment.
Got someone here to see you.
Oh, my little baby.
We might pop her down on the floor, okay? You can pop down here. Oh, good girl. Oh, Roxy, there we go. We got you. Good girl. Is your mum?
Hello, sweetie. Hello, little Roxy. Oh, you're a good little girl, aren't you? You've been in the wards.
Oh, yes. Had a tough old time.
Roxy is one very lucky little girl. If Jenny hadn't been there, I don't think she would have made it.
So everyone's calling me a hero.
Oh, you are a hero.
I'm terrified of snakes.
Well, that's what makes it
and
so
when my
special.
daughter said, you know, grab something and just try and get the thing off her, and I just stuck that in, the broom handle went through, and I didn't know what I was doing, really, you know.
Just a mother trying to save a little girl.
And because of her legs, you know, she doesn't run, she can't get away.
Can't get away.
Well, you know, she wobbles and falls and that, you know, so I'm always very careful.
Took x-rays of Roxy, and what we were looking for, did she have any fractured ribs or anything like that, which is quite common, that it could have easily crushed her. So the fact that she hasn't got any fractures and she hasn't got any internal damage is pretty, it's a miracle. I mean, she's remarkable how, even with everything that's happened, she's really doing so well. And I mean, if she's eating and we can keep her comfortable, then, you know, we want to try to get her home to you. So
I don't mind if you think to keep her
for a bit longer.
For a bit longer,
she's
just
been
to
through
keep
so much.
an eye on her.
Yeah.
Because if anything happens, you know what to do.
Okay, let's see if she'll eat some chicken. Let's just see, it's a little bit warm there. Eat a bit of chicken? Ooh, that looks like someone who's interested in chicken.
She loves chicken.
Does she? I was hoping she would. I can see she's interested, but she just doesn't quite feel like it yet.
She's
just not quite ready.
Just a bit weak and thinking,
Yeah, yeah. And sometimes they feel a little bit sick, and even with the drug, she's, you know, the pain relief she's had, sometimes it can make them just feel a bit funny in their tummy, and I think she's tired.
She's ready to go back.
And we'll get her back on her pain relief and everything like that. So, okay.
Bye, sweetie. Bye.
So see you tomorrow, Mum. All right, we'll see you tomorrow, okay?
Yes.
Okay. Come on, sweetheart, let's get you back to bed, darling.
Roxy's going to spend another night in the ICU, and hopefully by tomorrow her condition will have improved.
Hey, I saw your bed out. Hey, are you okay, sweetheart?
In Sydney, Audrey's bringing 6-year-old Turbo in for surgery to his right eye.
All right, we're here. This way, this way, this way, this way. It concerns me quite a bit that Turbo's had this eyelid problem for quite a while because it's been scratching on the surface of his eye. It's probably had, you know, scratching and ulceration there at some point in his life. It's a good idea that we correct it before there's any long-term damage. Hello. His eye's looking really sore at the moment. He's really closing it. It's very, very red. So I think once the surgery's done, he won't know himself. I know, good boy.
First, Audrey needs to make sure anxious Turbo is healthy enough for a general anaesthetic.
Good job, well done, good job. Very good.
That's good blood flow. So we just check his liver and kidney are functioning okay so that he has a safe anaesthetic. What a good boy you are. Good job. That's all we needed. Everything looks normal. His kidney parameters, his liver parameters are all within normal range. So healthy, ready to go. Properly, bend your knees. Right, ready. Oh my goodness, you're heavier than you look. Ugh. So it's always really tricky to do any surgery around the eye because it's very, very delicate. So we're hoping to achieve with surgery to remove the excess skin on the eyelid and then just roll it out so that that hairy part of his eyelid is not actually rubbing on his eyeball. And you can actually see how red the eyeball is and how red the conjunctiva is because he's constantly having that eyelid edge rubbing. So effectively what we're doing is we're removing a crescent shape of skin, and when we suture the sides back together, it will roll that eyelid out. Play. So we want to be really careful that we don't remove too much eyelid because of course we can't reverse that. So you'd rather stick on the conservative side, remove less, and if we need to go in and do it again, we can always do that.
The delicate surgery will be just millimetres from Turbo's eye.
So I'm going to make a crescent incision.
We'll keep an eye on that because we don't want them getting too warm.
At the Bondi Veterinary Hospital, Kate's about to perform tail surgery on pet sheep Callie.
Kato's removing all of the wool from the area and she's got to clip this tail. Callie is some kind of a mixed breed sheep. I can see that he's got some Dorper in him, but he's got a large amount of Merino in him. Trying to get dog or cat clippers through this wool is a really big task. These guys are woolly.
Kate will be under pressure to remove the exact amount of tail.
If we take this tail too short, these guys can get sunburnt down around their tails. So if you don't cover that bottom properly, it can be a real risk for them. We want to try and keep this general anaesthetic as short as we possibly can. Sheep are the trickiest of animals to put under a general anaesthetic. These guys can regurgitate at any time, they can get hypothermia, problems with their breathing, so many things can go wrong. And the longer that Callie is under general anaesthesia, the more risky it is. The first thing we need to do is cut the skin, and we need to make sure that we leave enough skin so that we can get this closed. So we need to cut a little bit lower to make a nice fold over that vertebral column. It's a lot bigger than a dog's tail, has a lot more blood vessels and a lot more bleeders. So when we cut, we need to make sure that we tie off or cauterize any of the little bleeders. All right, let's do it. Got one tail off. So now what we have to do is we're going to suture this up, and importantly, very neatly. Look at that. Covers his bottom perfectly. It looks quite cute, to be honest with you. I'm done. Good job.
I'm very happy with the job that's been done. He looks excellent. He looks a bit funny with a shaved bum, but yeah.
A new look Callie has been given pain relief and will be left to sleep before heading home with his family.
So I'm just making a little crescent incision to remove some of that excess eyelid.
In Sydney, Audrey is removing skin from Turbo's right eyelid that's been rubbing against the eyeball, causing him a lot of distress.
So the problem with leaving an entropium or an eyelid that rolls and scratches the surface of the eye is that you can get long-term damage. So as well as getting ulcers and scratches, you can actually get pigmentation or scarring that comes across the surface of the eye, and they can go blind. You can see that I've made like a moon-shaped incision, so if I remove that piece of skin, it's going to roll that eyelid out a bit for us. This is quite a painful condition. Maybe with time, Turbo's got used to the pain, which is quite sad for him. So I'm sure that when he wakes up from anaesthetic today, he's going to feel like a completely different dog. All right, so there's that skin. It's the tiniest little slither.
The final step is closing up the incision.
So it's important that we use really, really thin, delicate sutures because it's near the eye and we don't want any of those ends poking into the eye either. So I like to call it microsurgery because everything is so small and delicate. Your needle's absolutely tiny. So these sutures are special, as well as being really fine and soft. They actually dissolve after a while, so we don't need to go in and try and take them out. It's such a delicate area, we don't really want to be doing that near the eye. So I don't think I actually need to remove anything from the top. Now that I've actually rolled out the bottom eyelid, it's sitting really nicely.
But Audrey still has a concern that the constant rubbing on Turbo's eye may have left irreversible damage.
Now before we wake him up, I just want to check that there's no ulcers or scratches on his eye. So I'm going to pop a stain in, then shine a UV light, and that will show up any scratches there. It all looks pretty good. I'm actually in a bit of shock that there are no scratches or ulcerations on the surface of his eye because it is uncomfortable. He's had that for a while, and he's also been rubbing his face on everything he can find because it's so itchy. All right, ready?
Yep.
1, 2, 3.
You're done!
No, don't eat the cord. Come on, stop that. But it's the internet cord.
In Bondi, Callie the pet sheep is awake after his tail surgery and he's making himself at home.
He's well and truly ready to go. I'm going to send him home with his hay, so on the way he can have a comfortable journey.
Owner Emma can't wait to take her boy home.
It's been very anxious. I've been texting Maddie continuously saying, is he under, is he asleep, how's it all going?
Hang on, this way, this way, this way, come on.
I really am looking forward to seeing him. I just want to know myself that he's okay, and the minute he comes to me, I know that he'll be fine.
This will all grow back. Should look absolutely beautiful in the next couple of days.
Yes.
See you, buddy. See you later. See you later, alligator.
Kate's done an amazing job. It looks so good, and it's reassured us that we've made the right choice for his future.
Oh, I know.
In Sydney, 6-year-old Turbo has fully recovered from eye surgery.
Good boy. Come say hi to Riona. Come say hi. Good boy. I'm a little bit woozy. Turbo's heading home now. I think he's going to have so much of a better life. His eye's going to be so much more comfortable. He's going to be able to see well. I think Sammy's going to be very, very happy.
For Turbo's devoted owner Sammy, it's been an agonising few hours waiting to be reunited with her beloved boy.
Definitely keen to see him. I'm hoping that obviously he's got good eyesight, no pain anymore, and hopefully less inflammation, and yeah, happy dog.
Where's Mummy?
Hello.
Look!
Look at you.
Look at his little tail going.
Hey, look at you.
He's got his lampshade on.
Yeah, massive.
Just to make sure he doesn't scratch his eye. But you want to show Mummy?
Look, hang on, slow down.
So I'm very happy with how the surgery went. I think that eyelid looks great.
Yeah.
The big test is going to be in the next couple of days when that swelling goes down, how that eyelid sits on his eyeball.
Yeah.
But I think it's going to look really good.
Look at you, you can see now.
I know,
Yes.
you can see now.
Hey, you can see.
Does it feel weird with nothing rubbing on your eye?
Probably will feel
I
very
know,
weird.
he's not used to it.
Hey.
All right, get him home.
Yes, thank you very much.
All right, thanks for being an angel,
Come
buddy.
on, come on. Good boy.
I'll see you in a couple of weeks.
Yes.
Bye, Turbo. Come on. See ya. Sammy was very happy to pick Turbo up, happy that he's bouncing again back to normal.
Come on.
But for sure, that eye feels a lot more comfortable. Everyone's happy.
Oh, come on. Come on.
On the Gold Coast, Alex can't believe how well little Roxy is recovering
No in there.
after a near-fatal attack by a python.
Nobody likes to be in hospital, do they? Oh, darling. Hey, but I think you're doing very well.
The ICU team tell me that Roxy is really kicking goals today. She's eating, she's bright and comfortable. I think she's ready to go home.
Oh, you're such a brave girl. Such a brave girl. Hey?
After astounding everyone with her miracle recovery, Roxy can now be returned to her very relieved owner, Jenny.
Who I've got here?
Oh, look at you.
I'll pop her in a bed. Oh, that looks nice and cozy in there. Look at that. Good girl.
Roxy. Hello, sweetie pie.
Oh, look at her. She's so excited to see you. Is it good to see her again?
Oh, yeah.
Yeah?
Hey. Look at you.
You've missed her a bit?
Oh, I couldn't sleep last night.
Yeah. I'm sure you're going to be checking on her every 5 minutes.
Yes,
Tonight.
just like having another baby again.
You are a brave little girl, hey?
Oh, definitely.
Well, let's get her home, I think. Let's go. Good girl. I gotcha. All right, let's get you home.
Tell you what, if I see that snake again and it gets one of my, I'll know exactly what to do. Thank you ever so welcome.
I'm so glad she's okay.
Everything that you guys
You look after her, okay, and you look after yourself, all right?
I've just popped out from work, so I'm going to head straight to Brooke's house now.
After a busy day, Alex now has time to answer an SOS from another vet, Brooke, who's away on holidays.
She's given me a call because her mum's worried about the family dog Polo.
Mum Susan is looking after 10-year-old Polo for Brooke and is worried because he has a bad case of diarrhoea.
He seems to be fretting or he's not eating 100%. When she goes away, things always happen. And I've been worried about him. He is part of our family. We just love him so much.
Think I'm in the right place?
I'm very grateful that Alex could come and see Polo. I just wasn't sure what to do. Hi, Alex. Come in.
So I hear this little guy's not been well.
No, he's not. He's not normal.
Okay, let's start by checking Polo over. Okay, mister, are you ready?
Let's do that for Alex.
Check up. Good boy. Good man. Do I get kisses? Thank you. You're okay. You're okay. Yeah, that sounds good. Okay, that's all fine there. Can I have a feel of your tummy? There we go. And so when did the diarrhea start?
A couple of days ago.
Yeah, so just after Brooke left.
Yeah, that's
It's always the way, isn't it?
Yes. Brooke's done lots of tests on Polo, but we don't really know why he gets the diarrhea.
Is he drinking okay?
Yeah, he seems to be.
Yeah, good. That's good. He's nice and comfortable in there. No vomiting, nothing like that.
No.
It's not nice to have diarrhea, and if it does go on, he's likely to get dehydrated.
Okay.
So really happy with how he is on physical exam, and he's bright in himself. So it's really just a matter of us getting this diarrhea back under control. So I reckon we get Brooke on the phone,
Sure.
and I'll talk her through a bit of a plan for him.
That'd be great. Thanks so much, Alex.
Hey, Brooke.
How's my little man doing?
He's good, actually. I feel a lot better now that I've seen him. He's bright, running around, jumping all over the place. But he's got this diarrhea, and I can completely understand why your mum's worried about him, because it sounds like it's just constant.
So, you know, we've done the fecal testing to rule out those parasites. He's had an ultrasound to make sure that there's nothing going on in his gut. We've done the CBC biochem. That's all come back clear. So really I'm at a loss as to what to do next.
So what I'm thinking is we get him back on the antibiotics, because we know that Polo responds to that. But I've also got another idea for a yeast-based probiotic. And what I'm hoping it will do is to stop him relapsing. We'll stop the antibiotics, and then fingers crossed, he stays good. What do you reckon?
For us, that sounds great.
Cool, let's do it. I've spoken to Brooke, and we've got a plan for Polo, okay? So we're going to start him back on the antibiotics. We're going to also put him onto a probiotic to support his digestive health.
That's great.
Hey, is it dinner time, Polo? So what I want you to do is give Polo one of these capsules in the morning and one at night, okay? Break the capsule open and sprinkle the powder on his food. Yeah, it's nice and easy, okay?
Yes.
Perfect.
You want some dinner?
Dinner time. Hey? Sit. Oh, what a good boy. Eat up all your dinner.
Good boy.
Okay, I think my work here is done.
That's great, Alex. Thank you.
Good boy, Polo. I'll pop her in a bit. Oh, that looks nice and cosy in there. Look at that.
Good news for little Roxy. The much-loved pet has fully recovered from that near-fatal encounter with a python.
Come on.
Big Turbo has also bounced back after his eye surgery.
Look at your eyes, buddy. Hey, what happened to you, little guy?
And it's the happiest ending of all for little blind cat Rupert.
Hi. Hi, Rupert. Where are you? Oh, there you are.
He had surgery to make his eyes more comfortable and found a very special new home at another vet practice.
He makes the perfect clinic cat. I can see him sitting there welcoming all the new patients, making them feel comfortable. He's got his own little cubby over there. From living on the street to now having this life of luxury, he's one pretty lucky kitty. And we're so happy he's found a great home.
And even better news, little Rupert's now been given a forever home by vet nurse Dana, who fell in love and adopted him after losing her own cat.